My name is James Orbinski, and I'm a professor of global health at the Dalla Lana School of Public Health at the University of Toronto. You know, we think about life-saving medicines, and we think that everybody has access to them if they really need them. But that's just simply not true. 1 out of every 3 people on the planet don't have access to life-saving essential medicines. If they get a life-threatening illness, they're just simply out of luck, and they will die. Or they will suffer in a way that is not necessary because the medicines actually exist. So a number of organizations over the last 10 years or so have worked intensively internationally to increase access to life-saving medicines around the world. And one of the foci has been on HIV. And 10 years ago, or roughly 10 years ago, the cost of treating a person with antiretrovirals, which are the drugs that treat or used to treat HIV/AIDS, the cost of treatment about 10 years ago was about $15,000 a year for patented versions of these medications. And that person would have to take those medications, as now, every single year for the rest of their life. So at that cost, many people, particularly in the developing world, just simply would not get access to those medicines. And 10 years ago, the vast majority of people with HIV lived in the developing world, as they do now. But the vast majority of those people had virtually no access to those medicines. And it was considered that prevention was the appropriate strategy because the medications were just simply too expensive. Well, many organizations, Médecins Sans Frontières among them, Oxfam, Health Action International, and many others, worked in a coalition to try to bring down the price of antiretrovirals, and they were very successful. And now, today, 10 years later, these exact same medications cost about $80 for generic versions of antiretrovirals. And today there are now 5 million people in the developing world who are on antiretroviral treatment. 10 years ago there were less than 40,000. So engaging in critical public health issues, or critical global public health issues, can have profound results, and this is just one example. Now there are still outstanding issues. For example, many countries in the developing world don't have a manufacturing capacity. There are no factories that produce medications, and they still need those medications. In Canada, there's been an effort to create a piece of legislation called the Canadian Access to Medicines Regime, which is a piece of legislation that allows for generic producers here in Canada to produce a medicine that is patented in Canada for export to a country in the developing world that doesn't have a manufacturing capacity, and to sell those medicines at essentially generic prices. Now this legislation is extremely important, and Canada is not the only country doing this. Norway, for example, is also doing it, and a couple of other countries are doing it, and it's in complete compliance with the World Trade Organization's Trade and Intellectual Property Rights Agreement. But the problem is that the legislation is so complex, is so bureaucratic, is actually designed, in my view, so that nobody will actually want to use it. And that actually means that nobody actually wants to use it. So that legislation needs to be revised. It needs to be simplified, it needs to be streamlined, it needs to be made user-friendly, and it needs to be able to respond to real needs and not simply to the interests of those who don't want to see the legislation successfully used to address this issue of access to essential medicines. So for students, this is a very practical example here in Canada of a global health issue that is very local in the place where you can actually do something concrete to address the issue. So for students, I would strongly urge them to get involved in this issue, to contact, for example, the Canadian Legal Aids Network, to contact Dignitas, for example, and there are other organizations, but those are two that come to mind, that are deeply involved in this particular issue. And I would very much urge students to get involved, to start their own campaigns around making this legislation more effective, so that people who actually need medicines in the developing world can actually get them.